Okay, we're going to just demonstrate some really basic applications for the contour handle. There is so much rehab to be done with a handle that we're just kind of introduce a few things and show you just how well the product works. Again, you want to make sure you're anchored to something firm. Make sure you're anchored into a stud or a reinforced commercial wall. Do not anchor this into just a commercial steel stud. This won't hold up. So we're anchored in right here at the proper level. We're just gonna do a little external and internal rotation. You can see here how the strap comes through our contour handle real nice. It allows the handle to rotate without binding and catching on their knuckles, things like that. Go ahead and grab that for me. Good. Go ahead and just give me a couple of external rotations. So as you can see, it's functioning well. It's sliding within the system. It's not bunching up. It's not catching. It's allowing free range of motion. You know, some cheaper handles that I've used in the past, they just don't work right. They rub across the knuckles. They do different things. Go ahead and switch hands for me. As you can see, we're in our working space. You want to make sure you're within that range. Go ahead, internal rotation. Go ahead and take another step out, because as your arm is in full external rotation, there you go. Good. That's where our zero is at. So depending, you know, a lot of people talk, only do partial range, do full. I'm not here to argue any one of those stances. I just want to show you how well the product works here. Obviously, as a clinician or trainer, you're going to make your decision. But again, it's functioning well. There's enough space in here that it's not scraping across her knuckles. And comfort has a lot to do with compliance for our patients. And if they're not getting scraped up across the knuckles, they're going to be very happy about that. So we're also going to show here with two sets of handles. Go ahead and turn and face out that way. Scapular motions. She's just going to come straight out here. She's going to give us some, you know, dynamic hugs, push-up plus, whatever your term is that you like to use. I always make sure that when we're using this type when we're using these in this fashion, as you can see, she's actually leaning forward on that subtalar joint. She's getting herself into dorsiflexion. We don't want that. We want that means she's having to recruit a whole bunch more, and this is something, if you don't use a lot of resistance band training, that you need to get used to. If they are having to alter the way they stand, that means you've got too much resistance on the system. You need to back off. So because progressive resistance is based on the distance, you need to get them closer to your anchor point. As you can see now, she's out there and she's bringing it across there. Now her posture isn't altered, because if you have that much going on, the patient could potentially end up just leaning forward. We've seen this type of thing because they have all this altered proprioception and dysfunction. You know, I've seen people leaning on, thinking they're doing a dynamic hug or push-up plus. I've even seen them holding them in the same place and just moving their head. That's how dysfunctional they are through the thoracic region and scapular motion. So that's a key thing to keep an eye on, that they maintain their form. Progressive resistance, elastic resistance can affect the body in some different ways than weights, because weights only pull one direction. We're actually, our greatest force here is actually not straight down, it's pulling her back. So, okay.